an ovary is an organ that wears out before the rest of the body does. So therefore, anything we can do to improve the life and longevity of an ovary could potentially improve the life and longevity of other organs. Like, wow, this is like mind-blowing stuff, right? So like, why haven't we been studying this? Instead, we've been excluding women from research and, excluding estrogen, excluding ovaries from this whole picture because we thought they were, they're always changing, like
Right.
we can't have them in research. They're never the same 2 days in a row. And so they left us out of a lot of these, important medical decisions that were being made. And now we're realizing like, whoa, like maybe we should have been looking at this a lot more closely and figuring out like, what is it about women and women's lifespans that's so different? And like, what can we learn from that?
Welcome to The Ultimate Asset, the podcast where elite physicians, health strategists, and high-performing leaders explore what it really takes to protect and elevate your most valuable asset, your body and your mind. This is high-performance medicine powered by Velocity Health.
Thank you so much for being here. I know everybody really loved it last time we went live. You are such a source of amazing information. So I know that everyone's going to be super excited to hear your wisdom again.
I'll try to sound smart.
Okay. Yeah, I don't think you have to try that hard. No. So you guys, I'm going to just give you a little background. I have been working with Dr. Bussey and Velocity Health for 6 months, maybe?
Something like that.
Something like that.
Let's see. You started in July last year.
Okay. I did my testing probably in September. That's why. But I've been on my own health and wellness journey. Certain things that I had found were a little out of whack and also not feeling great, and things I didn't have answers to. After about 18 months of searching for the right partner, the right doctor partner, I found Dr. Bussey and Velocity. Full disclosure, my husband also works with Velocity. He was there first. And I really like and respect Dr. Deep, who Greg works with. But I felt like I really wanted a woman that was going to understand where I was coming, especially as a woman of a certain age. And lucky me that they brought you in as their director of women's health. And so it's been amazing. When I describe to friends my relationship with Velocity and with you, I feel like you are this like private detective investigator, like from SVU, except for without all the super yucky stuff. And like, you're looking at these things where I'm like, I don't know, like that's just sort of weird, or that's sort of been bugging me or whatever. And you're using that and then data and coming up with these things that I was like, and making a difference. Like there are things that we're seeing that are actually making progress and numbers that are changing and that kind of stuff. So that's my personal experience.
And some of it involves digging in things that are icky, like your own feces, which we'll talk about.
Exactly, like the poop test in the little try dish. Yep, it's a little gross, and it's worth it. It's just not like I have to be an active participant. So it's almost like going to the gym. Like I wish I could go to the gym and someone could go boom and I could have abs, but it doesn't. And I say that to my own clients too. Like it works best when we're both in it together and we're partners. And working with you guys has helped motivate me to be more accountable for my own health and my own eating and all these things. So we're totally going to talk about that stuff. My question for you, Dr. Bussey, is because I know it's International Women's Day month, right? So to focus on things that have to do with women. I know I had a lot of questions also that came in from the community. So do we want to start with sort of talking about gut health and women at different stages and then go into questions at the end?
Yeah, we can definitely do that. I think, one thing I wanted to say too about your health journey is that that's not necessarily like a unique thing. The system is designed for you not to participate, right? When was the last time you went to the doctor and they even listened to you for more than 3 minutes out of the 15 minutes that you were there? So it's more designed around like you come in, I tell you what to do, you take this medicine, you go home. Like there's no active. And I think that's what most people almost expect when it comes to a relationship with a medical person. They expect to go in and just be told what to do and something to magically change in their life. But that will get you so far. And the more times that you do that cycle over and over again, where you're like, okay, then we added this medicine. Well, this medicine caused this side effect because we didn't know that your health was actually headed in this direction. So we're not going to put you on 2 more medicines. Oh no, those interacted. And now like you're headed for all of these other things that we didn't account for. And now we're just like multiplying the number of like pills and diseases that you have. And the whole time you were just like along for the ride. You were like, I did everything you told me to do, right? Yeah. And you said eat healthy, but you gave me absolutely 0 parameters around how to do that. Or you said exercise more and gave me 0 parameters around how to do that. But then you said, oh, just take this pill. So you had no incentive to follow through, right? Like, well, I took this pill and my blood pressure got lower. So I guess I don't need that eat healthy and exercise business that the doctor barely talked about. So I don't think that that is necessarily any fault of yours or anyone else's, that when you go to the doctor, you don't realize you're going to actually participate in your own health.
Yeah. I mean, I sort of knew it, but it's nice to have a partner in the journey. And actually my mother-in-law, who recently passed away of blessed memory, I saw that. And obviously she was older. She was in her 80s, early 80s. So that was watching her sort of do that, like, here's one medicine, oh, that's causing a side effect. Then they put on another one and there were health issues there, and she was older and all that stuff. But it really, I think that was for me, a big reason, like a big kick in the pants to start this journey. Cause I realized that at 55, 85 is going to be here soon. And I want those years to really be as optimized, as vibrant, as healthful as they can be.
I think that's a big difference, right? I think when you think about the longevity space in general, you see a lot of male biohacking going on, like, we're going to live forever. This is like what we're going to do. And when I talk with women, it's like, you know what? I just don't want to be on this downward spiral during the last decade of my life. Like, they've seen too many women go from, thin and vibrant to frail old lady falling down and breaking bones. You see this medication spiral, and you're like, oh, wait a second, like, what do I need to do now so that I feel at least almost as amazing as I feel now, right up until I take that last breath?
Yeah.
And that's something you have to start thinking about, like, not just in your 50s, but, potentially even in your 40s and in your 30s, because especially as women, we're going to go through so many changes over the course of our lifetimes. We have the estrogen, we have a significant lifespan of our ovaries, which is one of our internal organs that, so many researchers are actually starting to look at. They're like, wait, an ovary is an organ that wears out before the rest of the body does. So therefore, anything we can do to improve the life and longevity of an ovary could potentially improve the life and longevity of other organs. Like, wow, this is like mind-blowing stuff, right? So like, why haven't we been studying this? Instead, we've been excluding women from research and, excluding estrogen, excluding ovaries from this whole picture because we thought they were, they're always changing, like,
right.
We can't have them in research. They're never the same 2 days in a row. And so they left us out of a lot of these, important medical decisions that were being made. And now we're realizing, like, whoa, like, maybe we should have been looking at this a lot more closely, and figuring out, like, what is it about women and women's lifespans that's so different, and like, what can we learn from that?
When do you think that research is going to like come out? Like, do you have any? I know you don't have a crystal. Like,
it's interesting because Columbia is studying like rapamycin effects on ovaries right now. So a lot of people maybe do or do not know, like, rapamycin is a drug. It's used primarily for anti-rejection for organ transplants, especially kidneys. Biohackers started using low doses of it, thinking it extended the lifespan by acting on these mechanisms of aging. I won't go too much crazy detail on that for you guys, but they were like, oh, maybe it'll make you live longer. And they've tested it in a few scenarios, especially like with mice, but obviously mice and humans are different. They're testing it in dogs, and now they're testing it on ovaries to see if they can preserve fertility in women longer. So we don't know when that research will be available, but it'll be interesting to see. And I think that's just the beginning of looking at ovarian longevity as like its own health indicator.
Interesting. Didn't know about any of it. It's amazing.
I'm a curious George.
I love it
myself.
Love it. So one of the things we had talked about, one of the things that I have been doing is the idea of how the gut microbiome influences hormonal balance.
Mhm.
And I know you've dug into a lot of my gut microbiome, partly things we're doing with supplements, partly having to do with like collecting my own feces for my poop test and dig through it and put it in, test tubes. And also, I'm guessing for this new diet,
Mhm.
histamine cleanse that I'm on. If you could take a few minutes and sort of talk about all those connections, because I don't think, again, most of us think about it. We go to the doctor at a certain age, we'll put on birth control pill or an IUD. Then we want to have babies. We don't want to be on it anymore. Then we go back on it again. And then it's like hormone replacement therapy. Bada boom, bada
Mhm.
bang. But there's a lot more to it.
Yeah, and honestly, like we think about all of the trillions of cells that are in our body that actually comprise us, and then there are these separate organisms, but they're actually part of the whole system. So they're living synergistically with us within the gut. And their populations are constantly shifting and changing in response to not only what we ingest, but the hormone signals coming from our body will actually impact the health of our microbiome as well. And that feeds back and forth. So I'm sure many people have heard, oh, there's a gut-brain axis, right? So there's a mini brain in your gut that's sending neurotransmitters and like changing their mood, and it affects depression. And there's also research showing that some of these microbiome produce GLP-1. So if you have a lack of diversity, then you tend to be overweight. So there's a whole bunch of things that are impacted by the diversity of your gut. So what we initially had started looking into with you was whether or not you had gluten intolerance, right? You're like, I feel better when I don't eat it. You're like, but maybe I have these other food allergies, food sensitivities. You're like, I break out in a rash, but I don't know if it's an allergy or what's going on. And you were taking antihistamines year round and like dealing with these rashes. And so what I often find that a lot of this just goes back to the health of the gut. And so there are actually bacteria in the gut that will produce histamine. So those bacteria usually don't belong there. They're pathogens. So there's something we potentially want to eradicate. There is also what we found with you was that your body was lacking an enzyme to break down histamine. So whenever you would eat foods that these bacteria fed off of, it would produce histamine in your system and you would break out in a rash, right? So there's no differentiating that from allergic reaction because that's the same. Mast cells are producing the histamine. It's the exact same mechanism of an allergic reaction, but it's not necessarily the specific food that's a problem. It's just an overproduction of histamine because of the foods that you were eating. The other thing we were looking at is a component of your microbiome that is always, again, changing as we age. There's actually great studies that show like we could actually determine like the age of a woman or kind of like what hormonal cycle of her life she's in based on the components of the microbiome. So there's an actual microbiome that is pathognomonic or gives away the fact that you're in menopause. So you have a certain pathogens that are present, low butyrate production, which is what we found with you. So butyrate is what's called a short chain fatty acid. The bacteria produce that as a food for gut cells. And then the gut cells make the, neurotransmitters and the hormones and also conjugate and detoxify those hormones all within your gut. So if those bacteria are dying off and you have less butyrate, that means you actually have less deconjugation of estrogens, which stops them from circulating in your body and can cause more menopausal symptoms. So as a whole cycle with this that we call the estrobolome, which is part of the microbiome that's involved in estrogen maintenance, I guess you would call it. Like they're not producing estrogen, but they're producing things that help with the estrogen balance in your body. So making sure that you have enough estrogen and also making sure you don't have too much. So, we're talking a lot about older women, but I also work with younger women. And sometimes they have a pattern of like too much estrogen, too little progesterone, too many androgens. I know people have heard of PCOS. That means potentially like too much testosterone. And sometimes what is happening there is the circulation of those things through the gut. The bacteria should be helping the liver in its job of detoxification. Well, if the gut microbiome is not happy, there's not enough fiber, there's not enough butyrate production, then you're just recirculating these hormones over and over again, and they're having problems with acne, thyroid issues, so many different things. And that was the other thing we were looking for with you, like, was the source of these anti-thyroid antibodies. So again, we were looking at the health of that, and so seeing low butyrate production was actually a red flag for why are you having these anti-thyroid hormones? Like, why are you feeling bloated? Why are you having skin rashes? Like, it all kind of came down to the gut and the microbiome.
And so, yes, actually, that's a good reminder. I need to order more of that butyrate stuff because I ran out.
Yeah. Well, hopefully we're getting your bacteria back to the level where they're producing butyrate on their own, and then you won't need the supplement anymore.
Okay, so that's not like a lifelong thing.
No. The goal would be to get you back to a healthy balance because you are on a menopausal hormonal therapy treatment. So we do have the estrogen signal returned essentially or maintained in your gut. So we should be able to get that whole system back in balance. And that usually just requires like the right kind of probiotic and a really smart supplementation with probiotics, because it's just like your traditional, like I bought this at the grocery store, it said probiotics on it, or I eat yogurt or those other things, like they're very non-specific, right? And so we've been targeting certain things with you, like akkermansia for metabolic syndrome and insulin resistance and other bacteria that tend to decrease as you go through the menopause transition. So when people say, I started going into menopause, not only did I have these symptoms, but my cholesterol suddenly got really high and I became insulin resistant and I gained a bunch of belly fat. And like a lot of that goes back to the health of the gut. And so restocking the healthy bacteria in the gut and adding fiber, like soluble fiber, especially, there's so many different kinds of fiber. Like we could talk all day about that, right? That's like saying fat, right? It's like, okay, so we have omega-3 fatty acids, we have omega-6, we have saturated fat, we have non-saturated fat, and so you can't just say fiber, like there's so many different kinds. So specifically, we've been trying different kinds of fiber with you to see how your body and how your gut bacteria respond to that. So that's just different food for different bacteria.
Right, because I was taking a fiber, but you said it wasn't necessarily doing enough and we had to switch and try some different ones. Of course, the one that worked for me is the yuckiest tasting one, but I put it in my smoothie and now I don't even know it's there. And it's a habit now. I have it every day.
Yeah. So we were looking for something that was very high in soluble fiber, where most fiber products, like if you look at the back of the container, especially if they're just for bowel regularity, they tend to contain a lot of insoluble fiber for stool bulking, just to kind of move it through you. So you want to look at the blend on the back of your fiber supplement, like how much of this is soluble fiber versus insoluble fiber, if it's like something called a resistant starch versus non-resistant starch. So that's usually going to be listed on the back, at least the soluble versus insoluble, and the other stuff you could ask a doctor or ask ChatGPT. They'll tell you what kind of starch it is, if it's resistant or non. So that would be a good place to start as well, because each of those different kinds of fibers are going to have different mechanisms, especially again when it comes to feeding the microbiome. Just like when you're growing a garden, right? Like you're not just going to like dump fertilizer on it. You're going to like have to specifically know like which ones need more nitrogen, which ones require, a certain balance of iron, right? Like certain plants require iron to be in there. And so different bacteria are like different plants and they require different fertilizer in order to grow. Someone said the name of the fiber. She's using psyllium husk.
Yes.
Plain old psyllium, delicious psyllium.
I use the organic
yes.
psyllium husk from Whole Foods. But so this is my question. Obviously, I think everybody should go to Velocity, but if they're not, right, how would one know what is happening, which fiber they should be on or what's happening in their gut microbiome, especially if most doctors are not testing for that, and then because even if hormone therapy is helping a bit, it's sort of not optimizing what it could be doing if your gut is off.
Yeah.
Right? Is that like
Yeah,
a
yeah.
layman's explanation?
Yeah. So, I mean, you're kind of looking for testing protocols that are aimed at not just really diagnosing, because they can't do that unless they're a physician and have a license to do so. So they can't really offer you diagnostics and treatment. Just like when you go to Function Health and you get the lab panel, they can give you some recommendations and they say they're expert led, but there's a whole bunch of stuff on the background that they just can't do. Like they can't write a treatment plan that's like specific for you, Hallie. Like they can give you general recommendations based on each of the lab panels. Some of those things exist also like in the gut health space. I mean, one that I recently did just a learning course on because I was interested in what it was is something called Tiny Health. So it's funny because I actually initially got one a long time ago when my son was a baby because he was born C-section. I was very concerned about the health of his microbiome. You know, like all these influencers are telling me I messed up my kid out of something that was completely out of my control.
Right.
You know, and so I get this thing, it's called Tiny Health, and I'm like, oh, because it's for tiny people. Well, it's actually for the tiny microbes. So anyone can have a tiny health test. And from what I've seen from the results, like they're more descriptive, I would say, than other tests. And again, I don't work for them. I've not seen that, but I know there's definitely other companies. I think one's called like Zoe, and they do both like oral and gut microbiome tests. So
I feel like there was one called Biome.
Yeah, Biome. Yeah, I think they do vaginal health also. Yeah, so you can basically like swab the microbiome anywhere apparently, and you get a readout from these companies. But again, what they're doing mostly is they're just like a lot of other like AI-based companies as well. They're aggregating data based on, you know, what research has shown about each of these individual microbes, what they think their action is in the person, but at the same time, like they're not really like talking to you. Like they don't know how these things are expressing them in your body. So it's almost kind of like when you read your horoscope and you're like, that's me. You know, like to a T, right? And you're like, wow, how did they know so much about me just from putting in my birth date, you know? And like, so I think it resonates with you, right? If it's like something that you're actually dealing with, and the people who are going to get these tests probably aren't getting them because they feel awesome. And so it's like the same thing when I see something on like a heavy metals test. It's like, this person has heavy metals greater than 99% of the population we tested. It's like, well, then that's pretty high considering probably the only people who are getting tested for heavy metals are people who think they have heavy metal poison. So I think like you have to think about the population that's being tested, like whatever you're doing, looking at the results. So you kind of have to like have that investigative mind with it, and say like, oh, like how is this going to be interpreted in the context of my own life, in the context of my own symptoms. But again, I can't speak to like the depth or breadth of what these tests actually go into. So that's why it's just the one where I've happened to seen like an overview of it recently in like a menopause and gut health seminar, and that was the test they were using, and I was like, whoa, that shows you a lot of interesting information, you know. So the test that I use most often is something called a GI map test. And there's also like, I think it's like GI effects is another test that a lot of doctors use. I think that's the one you used, but we recently changed it because each one gives us like different information.
Right. You guys look at it and say, this is the information we need for Hallie, so we're going to recommend this one.
Yeah,
Do you
exactly.
feel like that is, and again, I only know what you've done for me, but do you feel like that is one of those really important things that a lot of people are not necessarily getting, and that it's something that you highly recommend?
Yeah.
Everybody, just for women of a certain age? Like, is that?
No, definitely for everybody. It was interesting. I was actually having this talk on social media, not talk because I mean, we're not talking to each other, but somebody was saying to me, because I saw a post recently of this woman who was saying that she went into a doctor with an infection and she's very overweight. And the doctor basically was like, well, I'll treat your infection, but you need to lose weight. You should eat healthy. Just like some generic whatever response to her. And she was like in her car and she's like, you don't know me. You didn't even ask. Like, I actually do try to eat healthy and I'm not losing weight. and I am trying all these things, and like I felt like my heart went out to her, right? I was just like, oh my gosh, this poor woman. Um, what people don't understand is that if you're overweight or obese, like that didn't happen overnight, right? Like you didn't just wake up one morning and you were 400. And your body, your mind, your microbiome, everything has shifted during that amount of time that you were gaining weight. So when you go and try to lose weight, you have all these adaptations that actually are fighting against that. And so it's not just simple as like, take this, lose weight, take this, lose weight. And people, oh, you're failing our weight loss program. You're failing our weight loss drug. And they're not failing. Like their body is succeeding at what it is trying to do, which is maintain the fuel supplies that it's fought hard for, right? And unless you have that sort of like nuance and like compassion view, and another woman like pointed out as well, which I appreciated, she was like, yeah, like not to mention the microbiome. Like we know the microbiome in an obese individual is completely different from the microbiome in a non-obese individual, to the point where they've tried giving obese people fecal transplants in order to help them lose weight, and it's worked. Right. So like this is, again, like I said, the microbiome, the Akkermansia is producing GLP, it's supporting weight loss, it's providing satiety hormones to the body. It's doing so much. And when you don't have that, and then plus your brain is like jacked up the hunger signals and toned down the fullness signals, like it's not as simple as just say, eat less and then eat the salad instead of this steak. Yeah. Right. It's just not, that's not a fair thing to say to anybody. Yes. You know, and she was like, so, you know, what about the microbiome? And I was like, well, that's a nice thing in Velocity. I was like, probably most of my patients get a gut health test within the first 60 days of being a patient with me, because there's so much information there that like you wouldn't even dream of. You're like, the more I learn about like gut health, like the more in I am personally. And I used to think like, oh, this is one of those silly tests that functional medicine doctors like make their patients get so they can tell them like hokey stuff, you know, and like, now that I like get them and I see the impact that the microbiome is having in people's bodies, I'm just like, okay, sold. Like I'm a believer. And that came from a place of skepticism and like needing to turn up my openness and turn up my curiosity and really dive deep into what were the benefits of this kind of testing.
Yeah. And even like a GI doctor doesn't necessarily do it.
Oh, no, they just they do procedures. So GI doctors mainly do procedures. They want to put scopes in your mouth and up the other side of you, because that pays more, right? These types of tests are not reimbursed by insurance. They would be entirely out of pocket. So most doctors would have no experience with them, no interaction with them, because if they're working in a system where everything's insurance pay, they're just not, that's not a priority.
Right. Which is a shame. Can we talk for a second about, you know, we were talking about hormones, menopause, and again, hormones are like this through your life. So I personally thought that you worked with, you know, women of a certain age, sort of like post childbearing, and then, you know, in that part, the sunset quarter of life. And I think I've talked about it on Instagram before. My daughter was having some issues. I sent her to a different functional doctor because I did not realize that this was in the scope of work that Velocity did. And instead of testing and then treating, they treated and then we're doing some testing. And she was sort of getting much worse from the diet they were putting her on and the different supplements, and they were like liquid things and they were gross. And then you and I did my genetic testing and found out about my histamine intolerance. And when you were telling me about what the histamine intolerance protocol was and the things that I couldn't eat, I was like, that's literally like everything my daughter is eating. Like, and she's miserable. Like it was making her worse and bloated and like skin stuff, all these different things. And you said, oh, well, she can come and see me. And I was like, wait, you see young people? What? And P.S., I don't want to give you guys a spoiler, but we've already switched her over and she's seeing Dr. Bussey now. But so tell me about, because I mean, I feel like I'm somewhat intimately involved, and I didn't even understand that you see women of all these different ages.
So it's again, like, because we talked in the beginning about the system, right? So we're in the system. And it's like we're shuttling you around. Like, so you stop going to your OB. Most women kind of stop seeing their OB because they're like, well, I didn't know I needed to see my OB anymore. Like, I stopped having babies. Like, I had menopause. I'm not even having a period. I don't need my cervix checked. Like, I don't really need any of this stuff. They kind of stop. They think they phased out of that system and they're going to go see a different specialist. There's no other women's health specialist in the system, right? And we've kind of taken all patients, but women especially, and like flattened them into like this two-dimensional model where we're like, women are coming to healthcare for hormones and weight loss and mental health issues. So sometimes they're depressed. So, and it's everywhere. It's like rampant. Today I went to a compounding pharmacy and I clicked on their women's health tab, and the first thing that came up was semaglutide, followed by tirzepatide. And then I had to scroll way down, and then there were hormones.
Okay.
Like, you guys, but that was all that was in there too. Like, it was like weight loss drugs, hormones. And so you're working within the system and you're like, okay, like I'm basically being reduced to this. Whereas at Velocity, this is a whole woman approach, right? Like, your hormones are not operating outside of your body, right? Like, there are estrogen receptors on every single tissue pretty much in your entire body. So within your GI tract, within your heart and blood vessels and brain, and there's estrogen receptors everywhere. So it's not just a sexual health thing. And it's not just, again, that all this happens at a certain age where your hormones suddenly become an issue, right? Like, they went away. Now we need to fix them. It's not that it's a problem. It's just that we're trying to future-proof your existence, right? And at any age, we can take what is working and what's not working and start to tune it up from the lens of your whole self, right? So if I'm speaking with Maggie, I'm talking about, her, health of her community, her social interactions, like, what is she doing? Where are her stress levels? How is that affecting everything that's going on with her? Not just her GI, her hormones, her skin, but it's going to involve a variety of different areas of her life because we're really a composite of how all of these things are functioning. So it's really important at Velocity that we're talking to whole women. We're talking to you about the things that are impacting you most and the things that are on the forefront of your mind. Because again, I'm super curious. So if a woman's coming to me and is like, kind of going back to the horoscope joke, but if like you're really into horoscopes and you're like, hey, my horoscope says that, Saturn is transitioning and I don't know what to expect for my health. We can dive into that if that's really what you want to do. I just think that every single thing we hear, like, we're taking in all of these things. They're coming into our body. They need to be processed by our body. And so we need to be thinking about that. And we need to be doing that at every single age that we're at. So there's an optimal health for a person who's in their 20s. There's an optimal health for a woman in her 30s, in her 40s, in her 50s. And we want that to keep carrying over like year after year, decade after decade, to have the absolute best health that you can have. Again, like we talked about with your mother-in-law in that last decade of life. So it's not just a free fall into the grave.
Yeah. Do you work with women that are in their fertility years that are having fertility issues? Is that part of?
Yes.
Okay.
Absolutely. Yeah. So we have a whole fertility protocol. Obviously, we're not going to be doing procedures ourselves. We're a digital health company, but we are looking for the best experts in the world. And I'm connected with quite a few of them who understand reproduction and fertility, especially from a natural standpoint. And again, that doesn't just mean diet and exercise. That means identifying endometriosis. That means doing the procedures necessary if you have a blocked fallopian tube. Like, that's still natural fertility. It's not, IVF. It's not intrauterine insemination. Like, that's just promoting your body's natural processes. But there are things that can happen when women are younger, like potentially an STI that caused scarring and damage of a fallopian tube that might need to be corrected in order for her to get pregnant when she's approaching her fertility journey. But other things do affect that, right? Your microbiome, your nutrient balance, your exercise, what we call the allostatic load of stress in your life. So, many women might not seem like they're over exercising, to the point of energy depletion. But I spend a lot of time studying that, like how low energy availability and how REDS, which is relative energy deficiency of sport, affects women, especially young women, because we're all told we need to be thin to be healthy. But if you're under eating, that means your body's not making thyroid hormone appropriately. It's not making estrogen appropriately, and your fertility is likely impaired. So it's really looking at all of those things and, again, bringing it back to a whole woman perspective.
If you're finding value in these deep dives into health and performance, please take a moment to subscribe to our YouTube channel. It's the best zero-cost way to support the show and helps us bring you more world-class experts. Also, be sure to hit follow on Spotify or Apple Podcasts. While you're there, leaving a 5-star review or a quick comment really helps other high performers find us. We appreciate you being part of this community.
Very interesting. Very interesting. The community, thank you guys for submitting questions, because I think that really, like Dr. Bussey and I both want to answer the things that are important to you. So some people submitted questions ahead of time. Thank you. And then those that have popped questions in the chat, we will also get to if there's time. So if you have questions you want to add in the chat, please add that. So one person asked, have you seen a woman approaching 70 years old having spotting, periods, and cramps?
I would definitely tell that woman, if she's listening, if she hasn't seen a doctor yet, she definitely should. If you are past menopause and you have stopped cycling for any period of time, so menopause would be 12 full months without any bleeding. If you've gone 12 full months and you have any spotting or bleeding, but especially if you're having cramping, I would get checked by a doctor. That it can be a sign of uterine cancer. So I would definitely get that seen sooner rather than later if they've done a full workup on that, which I can't imagine they have. If that's still an ongoing question that you have, there may be other things they need to look into, like endocrine producing tumors. But no, it would be very abnormal for a woman in her 70s to be having bleeding, especially associated with cramping.
Thank you. Okay, this is an interesting one, which we touched on the last time, because I feel like the big takeaway I heard from people after our last live was every woman should have vaginal estrogen. That was like the big thing. And so we touched a little on testosterone. So this person asked, why are doctors reluctant to prescribe testosterone to women? We need it, correct?
So yes and no, right? Like, you do have testosterone in your body. Your ovaries will produce testosterone that will decline as your ovarian function declines. Your body also produces androgens, which are testosterone-like compounds, from your adrenal glands. So you may have enough of the benefits of androgens from adrenal androgens with or without testosterone. So it's actually very similar to how we would treat a male. There's not an exact number that you're looking for. What you're looking for potentially are symptoms associated with testosterone depletion. I would say most women would say that they have low desire for sex. So low libido. That is, according to the Menopause Society, the only indication for testosterone. It's also not formulated for women. Like, it's not FDA approved for women at all. So most doctors aren't going to touch it for that reason, because, like we talked about before, if insurance doesn't pay for it and there's no diagnostic code associated with it, like I said, outside of what we would call hypoactive sexual desire disorder, HSDD. If you have that diagnosis, your doctor may or may not prescribe testosterone for you. They might actually prescribe 2 other drugs that are recommended for women, both of which don't really seem to work and have significant side effects. And so those are the 2 drugs that are approved for it. Again, those are also really expensive. Insurance may not cover those. So I would say most doctors are, first of all, not comfortable talking about sex with you. Like, if you bring it up, most of your doctors will probably shy away from the conversation, tell you that, oh, it's fine, women just aren't interested in sex, especially as they get older. Like, oh, that's normal. Like, I don't want to touch that. So I think there is definitely a discomfort in the medical profession with testosterone when it comes to female patients. They don't know what is too much, what is too little. They don't want to androgenize you, right? Give you a deep voice, because that's irreversible. Cause you to have acne, other signs of hirsutism, which is male presentation on a female, facial hair growth, hair falling out. So doctors are oftentimes very afraid to even dabble in testosterone, aside from med spas, which will definitely sell you something that they know you're going to keep coming back for over and over again, maybe with or without any rigorous science behind it. So they're oftentimes using pellet therapy, These pellets are not approved for women. There's only male formulations. They are implanting them, and the testosterone wears out over a period of time. Now, you may have a huge bump in the beginning and then very little until your next implant. Sometimes the implants might dissolve more slowly and you get kind of more of a regular release, but there's no real like science around how they disintegrate either, and how women's bodies react to them, because again, they're formulated for men and we've just kind of adopted them. In my experience and practice, I think there is a place for that. I think that women are not afraid of needles the way maybe some people think we are. Like, we're not squeamish around this, and men will inject testosterone. They will pin it. And, you know, I don't think women have an issue with that, doing that 2 to 3 times a week at a very, very low dose. And then we would just recheck your levels again. But I would want you to be having some kind of a symptom, not just to do it because you think there might be benefits. There's all kinds of, again, like kind of no research behind any benefits. So like they'll tell you it gives you more energy, it'll help you build muscle, it'll keep your bones strong. So will estrogen, if you have the right amount of estrogen. I've seen clinics giving women testosterone only menopausal hormone therapy, like no estrogen, just giving them testosterone because they're like, oh, well, we're dealing with all the side effects and the symptoms of menopause by giving you this. So you have to be really careful. And, you know, there was a study recently that showed that there was no change in women who were given testosterone versus not given testosterone when they were both given a resistance training program to follow. So they both developed the same amount of muscle mass. There wasn't more muscle mass in the women who were given an appropriate level of testosterone. Mind you, if you're given a huge androgenic dose, like you see the bodybuilding males using, then yes, there's a possibility you will have a significant amount of hypertrophy from that, but we wouldn't go that direction for most female patients. So I think that's really why you see a lot of hesitancy especially if it's going to be like your corporate doctor that you're going to at whatever health system. They're not trained in it. They're not comfortable with it. It's not reimbursed by insurance. And there's really only one diagnosis code that they can use in order to prescribe it.
So most women do not need testosterone, right?
From what I found, no.
Okay. What about, and I'm sort of jumping around in my questions, but one of the questions that someone asked was, do you work with women who've had breast cancer, specifically estrogen positive, that has then put them into menopause?
Absolutely. So there was a really, really good book, and if you haven't read it, it's called Estrogen Matters, and it was written by an oncologist who treated a lot of breast cancer patients, and he was extremely outraged at the results of the WHI, because he was like, there are women of childbearing age who have breast cancer who maybe still, you know, go on to have all of these symptoms, and we're just telling them no. Like, you can't take a calculated risk with estrogen in your later years. And his belief was very strongly that needs to be up to the patient and their doctor. If that patient is having these like horrible symptoms, their health is worse. Women with breast cancer are actually more likely to die from cardiac arrest and cardiovascular disease than they are from a recurrence of breast cancer. And having no estrogen puts you at risk for cardiovascular disease. So if that is the situation that you're in and you have a strong family history of cardiovascular disease, and again, that is something that you have to have a very serious discussion with your doctor, have a very good relationship with your doctor and say, like, these are the risks and benefits. But I, as the patient, I have agency, I have autonomy, and I have, you know, had these long discussions with you, and this is what I want to do for my health and the rest of my life. Again, that's not that anyone's going to push it on you, say like, no, you have to have estrogen, or no, you can't have estrogen. I think it's just finding the right balance and agreeing to what the risk benefit profile is.
People sort of figure that out.
100%. Yeah. And again, you have to go back to, because they're still working with their oncologist. I would say 99% of oncologists are going to freak out if you tell them, like, you can't live like this anymore and you'd like to dab a little estrogen cream on yourself, especially if you've had estrogen receptor positive. But again, if you are 100% in remission, if you're willing to, you know, there's a lot more screening that we do now that's cancer cell specific. So most cancers have a unique genetic and proteomic profile, it's called, so that those cells are actually taken out of your body and they get screened for all of these markers. So you could actually have a specific test developed to look for recurrence of those cells within your body. It's very similar to what we use, which is like a Gallery test or a Grail test that looks for the signature of cancer cells that are leaving their DNA that's methylated in a certain way into your bloodstream. So they've been testing this for a long time. And it's a very that felt to be a very early detection method, especially for cancers that are difficult to find in that very early stage, or we don't have good screening for. So we have good screening for colon cancer, breast cancer, we have mammograms, don't have good screening for things like head and neck cancers and other things. So that's definitely a way that there are advances, but again, they're going to be outside of the realm of traditional medicine. They're not going to be something that is covered, and a lot of the doctors aren't even going to have the time to talk to you about the risk benefits and alternatives, because the hospital system typically only allots them 20 to 30 minutes at the most to speak with you. And that's the hard truth of it, right? Like I heard an integrative cancer doctor, she's amazing, Dawn Musselman, and she worked for Mayo Clinic, one of the number one cancer hospitals in the country. And she had a thriving practice helping women navigate breast cancer, had 90-minute appointments with her patients. She was thrilled. And Mayo Clinic came back to her and said, you know what, actually, we're not getting reimbursed for these. So we're going to need you to cut these in half. And she was like, no, straight up, I'm not doing that. That's not in the best interest of my patients. And she left her job because there was no way she could do what she did, and the amount of counseling that she did, and the amount of emotional support and love she was pouring into these patients. There's no way she could do that in 45 minutes, right? And so you have to think about what is the relationship you want to have with your health? Like we talked in the beginning, do you want to be the agent in charge of your health? Do you want to have autonomy in this? Do you want a partner, not a paternalistic authority figure telling you what you can and can't do with your body? Then you're potentially going to go a route like Velocity, which maybe seems like a big cost, right? When you're looking just at our website, or you're like it costs that much per month. That includes all of your diagnostics for the most part. And you can look at our website to see what's included, what's not. We never upcharge a diagnostic to you. So if I'm saying you need something that's not included, right? Like Hallie, if you're having your GI test and that wasn't included, it's a direct pass through. I'm telling you, this is what the lab charges me for this test. It's, whatever it was, $300. This is how much you're going to pay for it. I'm not taking anything off of the top of that. We have a very clear and transparent relationship with our patients. We don't make money off of medications. We don't make money off of supplements. We don't make money off of testing. So you get your testing budget, and we decide how to allot that over the course of your time with us. Part of that comes from your initial payment. Part of that just comes from the monthly payment that you're making. You're also getting a health coach who's meeting with you all the time. Hallie, she's always available whenever you have questions. We have a nutritionist.
I text her on the weekends because I'll be like, wait a minute, what supplement do I take first? What do I do? I am.
And so she gets a nutritionist. Hallie has met with a nutritionist. We recently added a strength and conditioning coach to our repertoire. So for those of you who have no idea what to do when you go to the gym and you're like, I know that machine over there is for cardio, and you're feel overwhelmed. I think most women do. I did. I hired a trainer and I was like, show me how to lift the weights, and you have a strength and conditioning coach, and you have your doctor who spends not only that hour with you, every 3 to 4 months, but who's also always available, always, there to answer your questions. If Hallie's I don't understand what's happening here, I'm writing her a long email and I hope you understood what I said in that. Or I have another patient who sent me a research study the other day. I was like, what do you think of this research study? And I was like, all right, give me a couple days, right? Because I actually want to read it. I want to digest it. I just don't want to give you my reaction to the, conclusion section, which was whatever the researcher said that the study said, right? Because you have to look at things. You have to look at who were the study participants. What did the data actually show? And so knowing that somebody is going that extra step for you and for your health, that is what you're getting when you pay for a Velocity membership. It's not I $3,000 a month from my family to have insurance so that we hopefully never have to go to the doctor. You hopefully want to see me You like seeing me? And we're having those types of discussions. Like you wouldn't go to a hairdresser who you don't want to see, who does a horrible job on your hair. Right. And like, they're like, no, I'm not paying, $1,000 for extensions so that I can, look like I paid $10 for them. Right. Like you want that relationship. You want that experience of somebody who's looking out for you and your health and is your partner, and your guide, honestly. And that's what you're getting when you're coming to Velocity. Like you're getting a lot of experience, and also you're getting a lot of openness and flexibility, and somebody who's going to want to understand your values so that we can have those types of discussions with each other back and forth.
Yes. And I would say for me, just to put it in my world, and I'm not saying it's as much as a Birkin, but I would have Velocity versus a Birkin. Like to me, I know they're saying that like Birkins, are rising. It's a good investment and whatnot. For me, investing in myself and investing in my health is a priority for me. And so if I'm trading it off that way, that's my,
Because what are you going to do with that extra $20,000? And when you've begun that slow spiral, like you saw with your mother-in-law, right? Like, okay, like good. My Birkin appreciated by $5,000. Like, what is that going to buy me in terms of better life experience, right? And I think that that's one of those intangibles that people don't understand, unfortunately, until it's taken from them or they've seen it taken from somebody that they're close to. And they're like, oh my gosh, like that. When you really think about like, what does the last decade of people's lives look like? And you really get honest with that, right? We are all going to die. But that is either going to happen on your terms or it's going to happen on society's terms. And if you're buying into the existing healthcare system, your end is going to come on society's terms and it won't look like how you envision it. So I would really challenge everybody to envision, what does that last 5 to 10 years of my life look like to me? And how do I make that a reality? Because if it looks like playing with your grandkids, walking around Disneyland, hiking, putting your own suitcase into the overhead bin, then you should probably be talking to a doctor like me.
If you are enjoying the discussions we are having on the ultimate asset, check out our new research newsletter, Accelerate by Velocity Health. Every month, we focus on the newest scientific research published around the world. Our team of expert physicians and clinical researchers break down scientific papers and deliver you the Velocity Health perspective. Accelerate your health goals and optimize your ultimate asset. Sign up today following the link found in the description.
Absolutely. Okay, a couple other questions that came up. You talked about Gallery and preventative diagnostics. What about Prenuvo?
So that's a whole body MRI scan that can be purchased I think they're probably about $500, maybe different in different locations. I would say, again, it depends on what you think you're going to get out of it. There are certainly people who are so afraid there's a small cancer lurking inside of their body somewhere, and they've heard the, celebrities who have had something found on a Prenuvo scan that they were gifted, as part of the initial push for these scans, or an aneurysm that was found that was intervened on early. But there's always a risk. Right? And so the risk is that they find a small something, and now you're going to be doing more testing. You're going to be chasing down more answers, and maybe, depending on what they found, like having a potentially dangerous procedure. Now, is that a good thing if it saves your life and it adds years to your life? Absolutely. But you'd have to have, I think, a good reason to want to do it, because if you're like, I have an extra $500 and I just want to like satisfy my curiosity of what's inside my body, but that's kind of like the extent of the money that I have to spend on health, and then they find something. I mean, you could easily be tens of thousands of dollars in a hole just to come up with the fact that it was really nothing, that it was an anomaly that didn't mean anything. I think that, again, those are part of those like nuanced discussions where, like, yes, we do, a part of our advanced package of diagnostics, have people who want to have Prenuvo scans done. And it's just, again, like our Gallery, it's like, okay, if we find this DNA in your system, we're going to have to go looking for the source. And how are you going to feel during that time? Like, if you're absolutely crippled with anxiety now, not knowing what's going on inside of your body, and the test is going to show nothing, you're going to feel better. That's great. Like, that's the best case scenario.
Got it.
But if you're going to be crippled with anxiety because you found something you didn't know was there, it's really a risk benefit question. Again, you need to ask yourself if you're going to just go self-pay for it, or you need to have a discussion with your doctor. The other problem, it's a problem with these is that because if you are a health system customer and you go get a Prenuvo scan done and they find something that is not something typically your doctor will look at. So same thing with like a function health test or any of those other things. They'll be like, I didn't order this. Why did you go have this done? You know, and you're going to have all these other things done. And like those doctors are not going to look at it that way, right? Like I've had a patient who is like kind of looking at her own labs on her own time and her doctor basically called her crazy. Like, why are you looking for things that aren't there? You know, and I was like, no, like, but there actually was a signal there, but the doctor didn't want to take the time to look at it. And so you might get into a situation where you have these tests and you go to your doctor with them and they completely disregard what you've done. So I would suggest that if you're doing them, that you're working with a doctor. These tests do not come with a set of doctors. They're just tests. They're just data.
Got it. So you need somebody to help you navigate and interpret it.
Yeah, 100%.
Yeah, that makes sense. Okay. Couple other questions. Peptides, are they helpful?
What are you using them for? Insulin is a peptide. So if you're type 1 diabetic and you're taking insulin, I would say it's very helpful because you're not dead.
These are questions that feed in, so I don't know.
So again, but that's the whole truth of it is what are you using it for, right? So semaglutide, tirzepatide, those are peptides.
On like TikTok and Instagram, I've talking about the peptide, and they all have different like, numbers and names and that stuff.
Yeah. So tirzepatide, semaglutide, Ozempic, Mounjaro, those are peptides. So those are GLP and GIP, those are peptides. Those are useful for weight loss, right? There are peptides like BPC 157, body protection compound 157, people talk about a lot. Seems to be useful in acute injury, potentially maybe with people with gut health issues, but I would say the jury's still out on some of that. And a lot of them, you know, again, I'm very curious. I like to try things on myself. So I am deathly afraid of needles also. So like this was a whole process the first time I got peptides because I had to like be like that guy at the gym who's like filling up his vials of like little stuff and like drying up and like jabbing himself. And I was terrified of it. But then it turned out it actually wasn't that bad. But if I'm going to counsel a woman how to use these, like I want to know how it's done. Like how's it mixed? What's it look like? What is the sensation going to be like with it? So I think there's one going around that's a mix of different things, including BPC 157. It tends to go by the name Glow. They say it helps with hair growth and makes your skin shiny and anti-inflammatory. I use it recovering from a marathon. Seems to help. I mean, I recover in 2 to 3 days. I don't know if that's just because I bounce back really fast or because the peptides were doing something. I don't know. So I think it's really like, what are you looking to do with said peptide? Where are you sourcing it from? Because just like supplements, this is a completely unregulated industry. You don't know what's in that bottle. Like it could be just creatine for all you know. So creatine is everywhere now. It could just be some other white powder. You have no idea what it is. And so unless you know where it's coming from, you know what to expect from the results, you know what the potential risks are of it, right? Like all of these things do have potential risks. I have a whole book of different kinds of peptides. Like there's hundreds of different kinds of peptides. And it clearly lists in there, like, this is what you expect. This is what you monitor. This is what you look out for with each of the different types and like some of the various uses for them that have been studied, maybe not always in humans. So you have to look at that as well. So someone might say like the other day, someone showed me a great nicotine study. It was done on mice. And I was like, well, how much nicotine did the mice have to consume to get that? Like, is it enough to potentially kill a human? Because that was, something I looked at with resveratrol, right? Like the amount that the mice took was like half their body weight. So if you're going to take half your body weight in resveratrol, like maybe you'll see an effect. But if you're going to take a pill this big, I wouldn't expect to see anything. So again, it comes down to what is the effective dose? What are the risks and benefits? And what are you expecting to see? Because how else are you going to know if it's working for you? So if you're expecting that, like, I have this really bad shoulder pain, it's an old injury, I've done the rehab, I've done everything for it, and it still doesn't feel like it's getting any better, maybe some BPC 157 will make it feel better and maybe it won't. So you kind of go into it with your eyes wide open, knowing what you're looking for. And so you're not, again, just like having a wallet biopsy from these things, because it can turn into that.
Those are things, again, that you will work with patients on.
100%.
It's something that, okay. And it's monitored and it's
Mhm.
methodic and it's gone through and okay.
Because again, I know what I'm looking for, right? Like I know what tests I'm going to order to follow up on this. I know what I'm looking for. So I think that if you don't know, then it's good to work with somebody who does know.
Yes, for sure. Going back to gut health, SIBO, do you have any info on SIBO? This person was diagnosed post-menopause.
Sure. So again, you're looking at small intestine bacterial overgrowth. Hopefully that was diagnosed using a gut health test, but not working with you personally. I wouldn't really be able to give you any recommendations on that because again, like I'd have to see it. It really depends on what bacteria are overgrown, what they could possibly be causing. It's one of those things again where I said I was very skeptical of a lot of these like gut health, like non-specific diagnoses for good reason, because I feel like there's a lot of inexperienced practitioners out there selling people tests and treatments and diagnoses without a lot of evidence. So I'm not going to say anything about your particular diagnosis because I don't know you and I didn't know the testing process that you went through, but that's something where if you've gone through the right testing process and someone's seen it, they should have a protocol that's tailored to you and not just like a generic SIBO protocol. And if you haven't seen anyone and you're Googling it and you think ChatGPT said your symptoms sound like SIBO, I would say ask a doctor to do a GI test and actually try to diagnose SIBO.
Is there a connection with it being post-menopause because of the gut microbiome imbalances?
Possibly because because the gut microbiome is dependent on estrogen, just as we are dependent on them. There are certain pathogens, like 4 or 5 different pathogens that tend to overgrow in a person who's gone through menopause. So yes, that can definitely have a link there. And again, you might see other things linked to that, like insulin resistance and metabolic health declines, but it becomes cyclical, right? Where it's like first the bacteria overgrew, then I got insulin resistant. Now there's too much sugar and I don't tolerate certain foods. And that makes more bacteria grow that aren't supposed to be there. And it just kind of, feeds off of itself, for lack of a better term for that.
Literally feeds off of itself.
Yeah.
Last 2 questions. Can a woman continue HRT after age 60? And the other one is, should you get a pap smear if you're over 70? Women are confused.
Women older.
Women are confused. We don't know what to do after we're done having babies. And then,
And again, it'll go back down to like, if you go to just the gynecologist at your healthcare center, they're probably going to try to take your hormones away from you at some point because like that's not really a priority. And they're going to be more concerned about breast cancer after a certain age because more women past the age of 60 are going to be diagnosed with breast cancer, but that's whether you have hormone treatment or not, right? It's more common in women of a certain age and they're afraid to breast cancer. If you have been on that the entire time, you will have symptoms now. It's basically like having menopause now when you're in your 60s instead of in your 50s when you would have had it before. So your body doesn't just like, oh no, I magically know we're past menopause, therefore you're not going to have hot flashes. So you're still going to have the same symptoms. You're still going to have the same exact profile of like now suddenly you're insulin resistant, now your cholesterol's up, your heart attack risk goes up. So again, it's a very nuanced discussion about the risks and benefits of continuing treatment. But I have, talked to women and heard also from women like, I will die with this estrogen patch on my arm. You will not take my estrogen patch away. So I don't care if you're 80 and you have no family history of breast cancer and you're living your life and you still wear your estrogen patch every day. That's your choice. And I'm not going to interfere with that, honestly. But if you're going by the guidelines, again, the Menopause Society is a group of OBGYNs who are making recommendations based on what they think is safe, quote unquote, what they think they can project. And they're going to give you the guidelines. They're going to say, women in perimenopause take this medication, women in menopause take this medication. And at the age of 60, up to 65, I think they say, then we take it away. And that's just their recommendation right now. OBGYNs in practice will follow what the guidelines say because that is the nature of the business, right? Like you have 15 minutes with a patient, You're going to see them. You're going to do what you need to do. You're going to make refills when you need to make refills, and then you're going to cut things off when you need to cut them off, because hospitals have to balance the risks to their bottom line.
Wait, I just had
and then the pap smear. The pap smear
Okay.
one, again, it's really going to depend on you in your 70s. If you are a single swinging 70-year-old lady who is having unprotected sex with multiple men, you may still be exposed to HPV, which is the virus that causes cervical cancer. You absolutely should have a pap test, because you can still have cervical cancer at that age. There's also newer tests, like our team is looking into all kinds of newer tests to see. There are urine-based tests. There's actually, tests. This wouldn't apply if you're 70, you're not cycling, but there are tests that can collect blood during the menstrual cycle and look for abnormal cells that way. So a lot of really interesting stuff on the horizon. Again, you may not see it. Is it coming soon to a doctor's office near you? I don't know. It depends on the cost. But it's coming soon to Velocity, because at the end of the day, I care about your health and your comfort and your adherence to protocols that are helpful to you. Whereas some women might not want to have a speculum exam in their 70s. And if you're in a monogamous relationship with your husband you've been with since your 20s, then no, I would say you do not need a pap test at the age of 70. But if you're having frequent intercourse with new partners, then absolutely.
People have asked me this. This was not submitted, but people have asked me this, and I would love your answer. So because Velocity is primarily telehealth, right? How does that work for people? People still need to have a primary care physician. How does that work? Like if someone needs something and you're not touching, you're not feeling, how does that work?
Yeah. So it's funny because I have actually worked in telehealth since 2016, which is like hard for most people to believe. When I used to go to present at conferences, and like the Uber driver would ask me what I did for a living, I'd tell them that we essentially Skype with patients, because even Zoom wasn't a thing in 2016. Like that blew up during COVID too. And they were like, people talk to their doctor via video call? And I was like, yeah, that can actually, there's a lot that you can accomplish in a video call. Like, surprise, surprise, patients can tell you if something hurts when they press on it, and patients can tell you what they feel if you say, like, do this, like, do you feel anything? Because most of the time when you go into a doctor, you're telling them, like, I felt a lump in my neck. And what if the doctor can't find the same lump that you felt? Say like 80% to 85% of diagnosis actually depends on a good history. So developing rapport with the patient, having them open up to you, having them tell you all the details of their life is really important. And then correct diagnostic testing ranks really high up there. Correct and appropriate diagnostic testing. And the physical exam actually falls pretty low down, especially for most doctors that like I've interacted with, unless like, let's say you're an orthopedic specialist, you probably give a really great knee exam, right? Like you do those all day, every day, and you know what a torn ACL feels like. But your doctor at the urgent care, I'm telling you, they have no idea what a torn ACL feels like. It's like really, really obvious. So I think a lot of times the physical exam is not the art that it used to be. And doctors are oftentimes relying on diagnostic testing to get to a diagnosis in a lot of cases, or completely relying on the history, right? Like you're like, I've had a cold for 2 weeks and my face hurts really bad and I've got a fever and ear pain. I don't need to look in your nose to give you Augmentin for your sinus infection. Like it's just not. If you come to me in a clinic, I will look in your nose so you feel like I did something. But a lot of diagnostics is just really good listening skills, understanding disease processes, how they present in different individuals. When it does come to diagnostics that you need, we have a whole team that coordinates that. Again, working since 2016 in telehealth, I have that advantage. And so does our whole team. Like we can coordinate care remotely really well. Like I would coordinate care for patients who were injured in states far remote to me. So, I'm not dealing with you. I'm treating you. You're in Florida, Ohio. I'm in California. That doesn't prevent me from ordering a diagnostic test for you and you having it done locally. It doesn't prevent me from finding the right specialist for you who's local to you and having them do a targeted physical exam, right? And like finding and collecting and connecting the dots for an individual to get them the treatment and the diagnostics that they require. So no, I think that having a telehealth doctor actually means that you spend more time talking and you spend more time learning from each other.
Yeah.
And then everything else can be coordinated to be done. So I feel like you actually get more from a digital health experience than oftentimes from an in-person experience.
Amazing. Amazing. Okay. So in our wrap up, last time the takeaway was all women need vaginal estrogen. What is our takeaway this time?
Your gut health is so important to your whole body. And honestly, we're whole people. We deserve doctors who can take care of our whole selves, not a collection of specialists who don't even talk to each other.
That is so true. Preach, preach, preach. Amazing. Thank you, Dr. Bussey, so much. Personally, thank you. Thank you for taking the time to talk so that everybody can learn and listen. And people are saying thank you.
Absolutely. And sorry if you had to wait a really long time to have your question answered. We just had so many questions.
So many things to talk about. So totally appreciate it. And I hope you guys will follow Velocity. I hope that if you have questions, you will reach out to them. I don't ever talk about things that I don't truly love and believe in. And I am so grateful to be part of have Velocity in my life. So thank you.
Absolutely. It's always fun speaking with you. And we'll do this again.
Amazing. Thanks, guys.
Thank you for listening to The Ultimate Asset. Until next time, keep investing in your greatest asset, yourself. This podcast is for informational purposes only and does not constitute professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or before making any changes to your health regimen. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. Reliance on any information provided in this podcast is solely at your own discretion.